Hi, nice to see you again. So, in preparation for your upcoming hair transplant procedure with us, we decided to record this video, and we're going to go over some pre-operative instructions that we recommend our patients to take prior to their procedure to make everything safer and more convenient, more comfortable for you and for us as well. This again is a video about our pre-op instructions for our patients, but this information can help you because it's pretty general and it goes over some of the things that we consider important in preparation for a surgical hair transplant procedure. Hello again, nice to see you. So this video was recorded to give you some instructions on how to prepare for your upcoming hair transplant procedure with us. We appreciate your trust. We'll make sure that you have a great experience and of course great results, the most important thing, right? So in preparation for your upcoming procedure, there are some things that we ask you to do or not to do. So that's the purpose of this video. We're gonna go over each one of them. If you have questions, feel free to call us, but I'm looking forward to taking care of you. I know this is a big step, but you'll be happy at the end. That's our main goal, of course, is that you have not only a great experience, but also a great result. I've been doing this for over 20 years, and as a surgeon by training, I'm very peculiar on how we do things in the operating room. So rest assured that you're gonna have all the care from us, from every aspect of the procedure, from the medications that we give you, to monitoring you, to make sure you're warm and comfortable, to all the precautions that we take for everything. So rest assured that everything's going to be done with the utmost care. For you as a patient, it's important that you have a great experience during the procedure. Hair transplants are very safe procedures. They're very comfortable procedures. I've had them in the past. When done correctly, when all things are followed, you should leave my office thinking that this was a very easy process and that you didn't have any pain and that was very comfortable. So don't be worried about anything. When you come in the morning of the surgery, you and I will talk in length. We only do one surgery at a time, so we'll have plenty of time to talk to you and plan everything out. Only after you and I are in agreement with what we're going to do, I'm going to mark on your scalp and draw and all these things. Only when we agree with the process, I will give you something to relax. We don't do any IV medications. We don't do general anesthesia. I only give you a little Valium type medication to take by mouth, so you'll be relaxed. And of course, we do everything under local anesthesia, very comfortable. In our room, we have a nice, comfortable chair for you. We have blankets for you to keep you warm. And we have a TV, we can listen to music, you can watch Netflix, and then we serve you lunch. So it's a very comfortable environment. My staff has been working with me for many years. It'll make you feel like you're at home, okay? When you get ready to leave from the surgery, we'll give you some post-operative instructions. I will record another video for you to access that too, but you'll have written instructions on what to do, what not to do, what to expect, and you'll also get my cell phone number so you can call me, text me anytime afterwards. You can text me pictures and then we'll be following up with you. Regular follow-ups are going to be periodically done as well to check your growth and your results. But this is just the first step of our relationship. I have patients that I've been following up for many, many years, ever since I started doing this. And I have patients that have done the surgery on the father, on the son, on the grandfather. So families that have been with me for many years. So to me, it's very important that we maintain our relationship, and all starts here. But there are certain things that you can do to make my life easier when I'm operating on you, when I'm taking care of you here. And that's the purpose of the video. So the first thing that I recommend patients to do, that you do, is to stop drinking alcohol about 2 or 3 days prior to surgery. Alcohol can influence the medications I'm going to give you. Remember I told you about that little Valium type drug? So alcohol doesn't go well with that. So don't have anything in your system, no alcohol, for about 2 or 3 days. Particularly red wine can make you bleed more during the surgery, so also don't drink. That's another reason for us to recommend no alcohol. Again, 2 or 3 days prior to the procedure. And then we're going to recommend that you don't drink any alcohol for a couple of days after as well. Second thing is also about 2 or 3 days prior, don't do any heavy exercises. It's okay to go out for a walk or anything like that if you don't want to be totally out of exercise. I have a lot of patients that are bodybuilders and health fanatics, and that's great. It's nice to take care of your health. I should be doing the same thing too, but I don't. But that's a separate conversation. But for the surgery, if you exercise heavily right before, your body will be pumped, your blood will be pumping, your heart rate will be higher, and then there will be more bleeding, more swelling after the procedure. So to make it easier for us and for you, stop exercising heavily 2 or 3 days before. As I said, you can go out for a walk or do a bicycle ride, something light, something relaxing, but no heavy lifting. Third thing that's very important, of course, you shouldn't smoke at all, right? We all know that. I'm not gonna be here hammering on that for you because you probably heard that many times before. But if you're gonna go through the surgery, stop smoking a day before, 2 days before, as far as you can go. And I know it's difficult, but it's important because nicotine is a potent vasoconstrictor. What it does, it makes the blood vessels in your scalp and all over your body contract. And that can actually impair your healing and impair your growth in the transplant. So general advice, of course, don't smoke at all. But if you do smoke, try to keep from smoking a couple of days before the surgery so we don't have to deal with that during the procedure. I know it's easier said than done, but that's our recommendation. Also, stop taking all of your supplements, all your vitamins. Not all of them have issues with the procedure, but some of them do. And since supplements are very variable, they all contain different concentrations of different vitamins and minerals, we want to avoid them altogether. Particularly vitamin E in fish oil type supplements. They make you bleed a little easier during the procedure, and they're very good for your health, and we want you to continue taking them. But in preparation for the procedure, as I said, 2 or 3 days before, stop them so we don't have to deal with extra bleeding or anything during the surgery. You can restart a few days after. Now the do's, right? Do wash your hair either the night before the procedure or in the morning of the procedure. We start our surgeries very early at 7 in the morning. So whether you're driving or you're staying over with us in the hotel nearby here, wash your hair the night before or in the morning. We will clean your hair with a surgical shampoo. We'll make sure everything is done very cleanly, of course, but it helps if you wash your hair a day or in the day before or the morning of the surgery. Also, in the morning of the procedure, have some breakfast. We don't want you to come in fasting. Don't need to. We're not going to give you any general anesthesia. We're not going to put a tube down your throat. This is all just very relaxing and all local anesthesia. So get something to eat, something light. Doesn't have to be anything heavy, but do come in after you have breakfast. But when you have the breakfast, try not to have any coffee, particularly caffeinated coffee or caffeinated beverages. It's okay to have decaf coffee. If you're like me, I like my caffeine, so but try to avoid that in the morning of the procedure. The reason why is, again, caffeine will increase your heart rate, will increase your blood flow, and so we don't want to deal with your heart being fast during the procedure and any more bleeding. You can have a cup of coffee after we're done with the procedure. We always recommend patients to wear a button-down shirt coming into the office. This sounds silly, but it's helpful because if you have a shirt that you have to pull over your head, it might be a little difficult and you actually may traumatize the transplants. Remember, you're going to leave the office with all these little implants in there. You're going to wear a little bit of a bandage for the first night or whatever, but it's easier if you don't have to pull the shirt over your head. So come in with a button-down shirt. We will give you some clothes to wear here in the office, but it helps if you have shirts that you don't have to pull over your head. And I would recommend wearing those shirts for the first 3 or 4 days after as well, just to avoid trauma to the transplants. Another thing too, of course, during the consultation, we talked about your allergies. I asked you that question, so you already gave me, it's on the chart. But we're going to ask you again in the morning of the procedure. Again, it's all about following safety protocols, right? But if you do have an allergy, remind us of that in the morning of the procedure so we can avoid any problems. Again, we don't use a lot of medications during the procedure, but if you're allergic to an antibiotic, for example, or to a painkiller, just let us know. We're going to be asking you, of course, we already have. We're going to ask you again, but just keep that in mind to remind us. Also, I already have in your chart your medications that you use every day. We already talked about that during the consultation. So I have a list. If anything changed, or if you're not taking something that you were at that time, just ask you about that in the morning prior to surgery, but just come prepared for that. It helps me as a doctor to make sure that we are safe, that I'm not going to give you anything that might interact with your medications. If you follow these instructions, we will have a great experience. More important, we're going to have a great result. Everything will be safe. You'll leave the office here with a smile on your face. A little tired, of course, but that's par for the course. But you'll leave the office telling us, like everybody says, that this was really easy, it went really well, and we're going to take care of you afterwards for the results there. But do follow these instructions, and we look forward to taking care of you. Again, if you have questions, you have our number for the office, call us. My staff is always available. I'm always available as well. And we're looking forward to taking care of you, okay? Thanks again for your trust, and the journey starts here. I'll see you soon. Take care.